We all know that vaccines have been quintessential in protecting children and preventing several vaccine preventable diseases. We all accept that children need vaccines and the vaccines are started as soon as a child is born. But in spite of the vaccinations, the immune system of a child is very, very weak. It is not developed, and so the immune response takes time to establish. So the first year of its birth, the child is prone to complications of several infections. There is also the additional fact that some vaccines cannot be given to a child unless the child is 12 or 15 months old. This also makes the child vulnerable to these infections. So how do we protect a child during the first year of its life? We resort to a technique called cocooning. Cocooning means protecting the child, ensuring that the child does not get infections from the other people in the household. This may be the parents, the grandparents, members of the extended family, and also people who come to visit the child. In fact, when several grandparents from India go abroad to take care of their daughters or daughters-in-law when they give birth, doctors in the West insist that they get specific vaccinations to protect themselves so that they cannot pass the infection to the grandchild. The usual vaccines which we advise for older adults and grandparents will include tetanus, diphtheria, pertussis vaccine, the flu vaccine which is advised every year. We also advise the pneumococcal vaccine for older adults above the age of 60, and also the shingles, which is the herpes zoster vaccine, or sometimes the chickenpox vaccine, so that if you protect these elderly population from getting an infection, the child is automatically protected. I think we have to resort to this strategy in India also to protect our babies.